Okay, so my country that I was given to describe or to identify with in the matter of healthcare was India. So I know you see in my title here where healthcare is done kind of different, and I've emphasized the word care. You're going to see why in just a little bit, so just bear with me. First off, let's talk about just the sheer size of India. As you can see just in the picture itself, it's just a very, very large country in land mass. And as you'll see later on, and as more I talk, and just this causes issues in the matter of healthcare. Just the sheer size of the country, it's almost 3 billion square miles, which is just almost, it's almost hard to imagine that size and how you would even begin to take care of that size of a country. And not only that, but their population is very large as well, with over 1.2 billion people and growing every day. So just a vast, vast country and a vast, very, very large population. Some of the resources they have in healthcare, we're going to talk about that. So they produce over 25,000 physicians annually, and yet there's still a shortage. And that just goes back to what we just talked about with it being such a large country and so many people. Um, they're just not enough physicians to go around, and as you see in my next point, they also choose a lot of times to go to other countries to practice, which is just a common thing in every um, profession. But you want to go where you can make the most money, and so healthcare and physician and is no different. And there again, the patient volume is just so high. The healthcare workers just can't compensate for the volume that they're inundated with. And this stat just kind of helps prove that an average of zero point 0.7 physicians and 1.1 nurses per 1,000 patients. So I mean, you've got one nurse on average in the country trying to deal that would have to deal with 1,000 patients. That's just not going to happen. It's impossible. Another area in healthcare that drives it is money. So let's see. Let's take a look at how much money is India putting into their healthcare. So they only spend 2.9% of their entire governmental budget. And I know India is a wealthy nation. But that is just, to me, is just a very, very low number when you're talking about your total budget. Only 2.9% goes back to healthcare. And on top of that, 70% of that 2.9 is spent on staff salaries. So let's just look at some figures here. So let's just pick $20 million. If they spent $20 million, then only 6 million is actually going toward healthcare itself, whether it be updating a facility or getting some new machine or whatever the need may be. But only 6 million out of that 20 is actually going back to that. So as you see, finances is a big issue in healthcare in India. So they also, let's look at some preventative measures that they take or lack thereof. One thing that they have to deal with in India is clean drinking water, and it's just simply not available to a large portion of the population. There are too many areas where it's just not there. Whereas here in America, we can go to the tap water, and I know a lot of people probably were too good for that, but in India, they would know what to do with water that clean. I mean, they have water that you can't drink because it will literally make you sick. And another thing that ties into that would just be unsanitary living conditions altogether. Part of India's problem as well here is there's just such a vast difference in the classes. So you have the super wealthy, and you kind of go straight from that to super poor. You don't have anything in between. There really isn't a middle class, And these kind of conditions will obviously fall into the poor. So that's a big issue. These two things here are big. And the availability of healthcare facilities, that ties back into what we talked about earlier with the size of the country. There's just not enough places to go. People can't get there, especially if they're poor. They can't afford to travel, and therefore they either just don't go or try to do things on their own, and that's just not necessarily usually a good idea when it comes to your health care. Patient information is another issue they have. Here in America, most places you have what's called an EMR, which is an electronic medical record. And once your information is entered in the computer, it can be sent to another doctor's office if you have a referral or whatever the deal is. Whereas in India, they don't have that in most places. And so if you go to the doctor, they're going to have to write everything down, try to keep up with it. If you go somewhere else, they're going to have to try to fax it to them, or it's just a lot of legwork and very not a very good practice when it comes to keeping up with patient healthcare information. There are illnesses that are due to that uncleanliness that we talked about, and direct correlation with those. One of them is diarrhea, and I know that seems small, but with extreme cases, it can lead to dehydration, and which can lead to death, and that just goes directly back to the unclean drinking water. They just have, and you get to a certain point, you're going to have to drink something, but it can cause a lot of issues. And malaria is another one, and this can be caused by lack of proper drainage systems. Stagnant water is a common breeding ground for mosquitoes, which carry malaria. So, you just put the two together, and you're obviously going to have a higher chance of contracting the malaria disease. So, I came across this quote, and it made me think of just the state of healthcare in India. And it says, when someone truly cares about you, they make an effort, not an excuse. I don't know, I didn't have a name attached to that. But I just feel like India just doesn't seem to care when it comes to healthcare. They don't put very much money towards it financially. There are not enough facilities. They don't have enough workers, which I know you can't really necessarily make people want to go into a field, but yeah, you kind of can, because you can make it more lucrative. You can, entice people to stay with incentives. And I just feel like overall, until they change some of these practices, they're never going to see healthcare truly be what it could be. And for their country, I think that's a sad place to be. Healthcare is changing rapidly, and they seem to be far behind the curve. And for a country as updated and as technologically savvy and things like that as they are, it's hard for me to fathom that their healthcare is so low on the totem pole, so to speak, that they just don't. There's certain things that just aren't done, and you would think, it being the country that it is, that they would already be past that. So, in my overall assessment is they just don't really care enough about their health care as a country to make it what it should be and what it ought to be.